Now we are going to start about autoantibodies that are just buzzwords to diagnose the disease, and that is just an association to get and catch the disease and get our answer on the exam day very fastly. For that, you have to recognize, you have to remember or learn about 2 to 3 days before going for your exam, or also before anything you have to go through. From that, all the autoantibodies is a very important association. For example, first antibody is anti-postsynaptic. It's a type choline receptor that is associated with the Myasthenia gravis, and anti-presynaptic voltage-gated calcium channels that is associated with Lambert-Eaton myasthenic syndrome. In both diseases, there will be decrease in muscle tone or weakness, lethargic, but maybe the Kangar pronunciation may be same, but mostly the important thing that's going to differentiate both diseases is about the autoantibodies. In Myasthenia gravis, the autoantibodies are formed against the acetylcholine receptor that was present on prosynaptic now, and the Lambert-Eaton myasthenic syndrome, there will be autoantibodies against the voltage calcium channels present on presynaptic site. Next, we are having the anti-beta 2 glycoprotein 1 that is related to antiphospholipid syndrome. Recurrent abortion in a female, maybe you heard, it is just like that. Anti-nuclear ENA is a non-specific screening antibody often associated with SLE. Is the anticardiolipin, lupus, anticoagulant, or I should say SLE and antiphospholipid syndrome. Is the anti-dsDNA and anti-Smith that are associated with SLE 100%. Is the anti-histamine that is drug-induced lupus. Whenever you guys are watch anti-histamine antibodies present in MCQ, just mark the question drug-induced lupus. Anti-U1 RNP ribonucleoproteins, that is a mixed connective tissue disease, these all are same. But they having for the subtype rheumatoid factors like IgM antibody against the IgFC regions or anticyclic citrullinated peptides are more specific anti-CCP that all are associated with rheumatoid arthritis. There is anti-Ro or SSC or SSP that is certainly associated with Sjögren syndrome. Anti-SCN 70 is going to scleroderma. There is already SCN already they mentioned in the antibody that is starting point of scleroderma. With the anti-centromere that is going to associate with limited scleroderma or CREST syndrome. Anti-synthesis or anti-SRP with the polymyositis or dermatomyositis, anti-mitochondrial primary biliary cholangitis, the most common cause of infants, liver disease or liver cirrhosis. Anti-smooth muscle, anti-liver kidney, microsomal 1, autoimmune hepatitis. Myeloperoxidase, anti-neutrophilic cytoplasmic antibodies that are already associated with microscopic polyangiitis and eosinophilic dermatosis with polyangiitis and ulcerative colitis and primary sclerosing cholangitis 1, ANCA and P-ANCA, they are the most common autoantibodies and related in many of diseases. You having a C-ANCA that will only having the glomerulitis, polyangiitis and anti-phospholipid A2 with a primary membranous nephropathy, anti-Hemmings desmosome with the Burroughs pemphigoid and anti-desmoglein with the familis vulgaris. Having the anti-thyroglobin and anti-thyroid peroxidase, there will be Hashimoto thyroiditis and anti-TH receptor will do the Graves disease. And IgA anti-endomyosial or IgA anti-tissue transglomerates or IgA or IgG deamidated gliadin peptides are going to cause celiac disease. Anti-glutamic acids and decarboxylate islet cell cytoplasmic or antibodies type 1 diabetes mellitus. Anti-pruritus cells are anti-intrinsic factory cause of precocious anemia, and anti-glomerular basement membrane is going to cause Goodpasture syndrome. In innate immunity defect, for example, we are having the disorders of leukocyte adhesion deficiency, there is the Celiac syndrome. Also, there is the chronic glomerular disease. For that, if we talk about the important points, in leukocyte adhesion deficiency, there will be decrease in neutrophils migration. Neutrophils migration. And if we talk about the Celiac syndrome, there will be lysosome fusion, impaired. Now, if we talk about the chronic rheumatoid disease, there will be decrease in respiratory burst, and also there will be recurrent infection of catalase positive.